All right. Looks like we are live. So, good evening, everyone. Hey, and welcome to this event we are calling Surviving the Medicaid Cliff. Now, tonight we're talking about Medicaid, and we're talking about some changes that are happening in Medicaid as a result of the end of the federal COVID public health emergency. And I think you're going to find tonight, I call it a cliff. It's a different kind of cliff. It's not something that everybody's going to hit all at once. It's not something that some people are going to hit at all. There's a lot of nuance here, and so that's why we really wanted to assemble this panel discussion to bring together a bunch of the experts in the state to help inform and educate on what this is going to look like. So tonight, I should note that our panel tonight is sponsored by, or this event tonight is sponsored by Anthem Blue Cross Blue Shield of Colorado. Anthem is a health insurer. They sell insurance plans in each of Colorado's 4 counties, and you can learn more about them at anthem.com. That's ANTHEM. So just a little housekeeping, give you the roadmap for the night. First, I'm going to introduce our panelists. Then we're going to do, maybe 10, 15 minutes of general discussion just to try to kind of set the playing field here. And then we're going to dive into the questions we received from you, our readers, our viewers. And I'm not exaggerating here. We have received dozens of questions. So this is going to take up the majority of the night. And I think we're going to get a lot of good information out there. You can continue asking questions tonight if you wish. You can do that using the YouTube chat function, or you can email them to questions@coloradosun.com, and we'll try and get through them. About an hour, maybe a little bit longer tonight. So we may not get to every question, but we're going to do our best here. So let's dive in. Let's list. First up, we have Kim Bimestefer. Kim is the Executive Director of the Colorado Department of Healthcare and Financing. You'll often hear that department referred to as HICPUF, which I got to say is probably the funniest acronym in state government. But it's also a very important agency because it oversees Medicaid and another program called the Child Health Plan Plus here in Colorado. Now we have second, Michael is the State Commissioner of Insurance. He heads the Division of Insurance at the state. Not as much of a fun acronym there, but he regulates a good number of health insurance plans here in the state. We have Kevin Patterson, who is the CEO of the Connect for Health Colorado Health Insurance Exchange. This is where you would go for insurance on your own or as a small employer. You would go there to buy plans for yourself or for your employees. And then we have Meagan Fearing. Meagan is a health insurance broker. And I'm really excited to have Meagan on because we did one of these events a few months back. And we should have had a broker on. We should talk to a broker. So I'm glad we have one tonight. Meagan is also the president of the Colorado State Association of Health Underwriters that represents brokers. So now that we got all that out of the way, let's dive in. So Kim, why don't you walk us through what is happening here and why?
Okay. This might be a little long-winded because it's setting the foundation for why we're here tonight. So first, thank you, John, for doing this. We so appreciate you and the Sun for just making this important and creating a platform for people to talk and ask questions. And thank you, Anthem, for your sponsorship. So we all think back to March of 2020 and COVID hit and we had never heard of it, right? All of us had never heard of it, couldn't spell it. And it just turned our worlds upside down. And one of the things that it caused is an economic induced circumstance where a lot of people across the country and here in Colorado lost their job. And when they lost their job, they lost their employer-sponsored health coverage. And so that was devastating for a lot of people. And it was really a privilege for our department and Health First Colorado, some people know as Medicaid, to step in and help. And that's why safety net programs like Medicaid or Child Health Plan Plus are here. So the federal government at the same time realized that people all across this country could lose their coverage during a pandemic that preyed upon the most vulnerable. And literally, remember, we didn't have a vaccine then. So the federal government stepped up and said, as people come on to Health First Colorado or Medicaid programs around the country, they did not want anybody to be disenrolled. So the goal of the federal government here in Colorado is keep people covered. And we did that as a state. And so our rosters at Healthcare Policy and Financing grew by 500,000 plus people, by 41% between March of 2020 and just this past month. And so for more than 3 years, we have not disenrolled anybody from Health First Colorado or the Child Health Plan Plus program. And now we cover 1.78 million people, or 1 in every 4. So this very unusual period of time, we're so thankful for this, but now we've learned to manage the pandemic. It's now an epidemic. We're in pandemic readiness, and we're all doing pretty well. So the federal government said in December of 2022, they passed the Consolidated Appropriations Act, and that act required all Medicaid programs across the country to now start planning for disenrollment and to actually disenroll. And then in January of 2023, just a few months ago, CMS, the federal government, sent out some guidelines. And so following those instructions, HICPUF has now started and developed a plan, which we've been working on for 3 years, waiting for this time. So we're very ready to say to our Medicaid members, okay, after 3 years of a pause, we now have to renew everybody. And even though we've been renewing everybody and going through the process for 3 years, we've never disenrolled anybody. So what's different now is we're going to continue the renewal process, but actually we're going to act on those renewals. So what's different is people could lose their coverage for the first time in 3 years if they don't act on the renewal process. So we've been working real hard for months and months getting ready for this. We estimate that about 80% of the people that we covered out of that 1.78 million will renew, and about 20% will not renew. Now, some of those 20% already have new jobs with employer-sponsored coverage. Some of them might have matured onto Medicare. Some of them might be on their parents' policies up to 26, but many people have stayed on our rosters. They're still eligible for coverage, and they need to start looking for other coverage. So what is really important about tonight is for everybody to realize what they can do to help keep Coloradans covered. And that's the main theme we have in this state now. Keep Coloradans covered. You can go to a website, keepcocovered.com, and learn more about it. But in the end, what we're all talking about tonight is making sure that of those 1.78 million people now on Medicaid or the Child Health Plan Plus, that you're falling into one of two buckets. One, you're going to renew with us. That's the 80%. Two, you're in the 20%, and we need to help you find new coverage, affordable coverage, so that you enroll, and you need to help yourself find affordable coverage so that you stay covered. And that's the goal of all of us working together. The number one thing that we all know is that people, when they don't get care, often it's because they can't afford to. And the number one reason why they can't afford to is because they're not covered. Now, here's some reassuring news. We are Colorado. We are working really hard. Everybody on this call, all of the state agencies are working hard under Governor Polis and Lieutenant Governor Primavera in this legislature to keep Coloradans covered. We have no interest of trying to get people off the rosters fast like other states are. We are doing everything we can above and beyond trying to keep Coloradans covered. To your part two, well, I'll leave it there, John. Why don't we, your issue is what's going on? What do people need to know? There you go.
Yeah. Well, why don't we talk about my cliff metaphor? Because this is a cliff that not everybody's going to reach at the same time. This is actually going to spool out over time. So how does that work?
Yeah. So we're estimating that 20% is about 325,000 individuals. And we're not, some other states are saying we're going to just disenroll people in a month, all those people. We're not doing that. The federal government said you could take 12 months to do it. And they said you could add 2 months for what we call noticing. So we're taking that full opportunity. So take that whole 1.78 million and divide it between May renewals and next April. And we started noticing in March, and we'll continue 2 months before every renewal month. Every month, we will notice people of how many of those people that are up for renewal in that month. And how do you know what your renewal month is? Well, one, it's the anniversary of when you first started with us. If you don't remember, you can go into co.gov and then PEAK, P-E-A-C, P-E-A-K. So co.gov/PEAK. All members should be looking for a renewal packet during 60 days before their renewal month. Again, if you don't know that, you can go to that website. You'll get a renewal in the mail. It's labeled in a big red letters, urgent, please reply. You can go and get it automated on that peak site. And so all throughout the year, somewhere between 65,000 and 100,000 people will be renewed, John.
So let's just talk very high level for people who are currently on Medicaid right now, whether you think you're eligible to be renewed, whether you think you might end up losing coverage. What's the most important thing you can do right now?
Most important thing you can do right now is make sure that Health First Colorado, or that peak site, that we have your updated address. And we've been working on this for more than a year, sending out reminders to individuals saying, hey, at some point shortly, the renewal process will start being determinate. In other words, we will act on it. So make sure that we can find you. After 3 years, people move around, or emails change, or their cell phones change. So we had, for example, in this past month, we had so many massive communications that went out. We had 65,000 people in the month of March that we sent notices to for May, and we sent 35,000 texts were sent out in English and Spanish based on people's preferences. 43,000 emails were sent out. We sent out 118,000 member newsletters that were received. So 171,000 people visited our site. So what can people do? Update their contact information and look for that renewal packet.
And Mike, I want to turn. So we've had a lot of questions from folks who are concerned about, I think I might lose my Medicaid coverage, and how much time do I have to figure this out? So can you explain what happens for people after, if they do end up getting disenrolled from Medicaid?
Yeah, John. So I think there's essentially two answers to that question. The first one is if they have availability of employer-sponsored coverage. So if they get covered health insurance coverage from their employer, or they think they might be able to, it's really important for people to be talking to their employer, to their HR department now, and start talking about what the available options are for them and what they can do to actually take advantage of those options. But there's going to be a second group of people as well that we're really concerned about, and that we're doing a lot of work for, that's going to enroll with Kevin's shop on Connect for Health Colorado. So people that don't have employer-sponsored coverage and that aren't eligible for Medicaid anymore because maybe they make too much money, they'll be able to go to Connect for Health Colorado and sign up for coverage. And they're going to be able to do that, John, in large part because we have what's called a special enrollment period that we're implementing for the end of the public health emergency. So it's wonky, and I know everybody hates wonky issues, but the Affordable Care Act effectively creates a window of time every year that people have to enroll in health insurance coverage. And they do that, it does that for a variety of reasons, for health policy reasons that people don't really care about when they can't find coverage. But what it also allows us to do is create what we call special enrollment periods. There's statutory special enrollment periods that are just standard, that are out there whenever people have certain life events, like they get married or they have a kid, that they can enroll people in health insurance coverage. But we created a special enrollment period. And I know I said special twice in one sentence, but bear with me. But the whole purpose of that is to create a period of time, a 16-month period of time that's starting in April 1st. We have to finalize a regulation. And it's going to go all the way to the end of July 31st, 2024, really at a minimum, that people that are rolling off of Medicaid are going to have the ability to go on to Connect for Health Colorado and see what options are available to them. And for a lot of these folks, as Kim talked about, they've been on Medicaid for 3 years. And a number of those people probably were on Connect for Health Colorado, were enrolled through the Affordable Care Act, through Obamacare prior to the public health emergency. But I think what's going to be really important, what may be very, very different for people, is that there's increased subsidies that are in play now that weren't in play back before the pandemic. So the Inflation Reduction Act increased subsidies from the federal government for people, but we also passed state level subsidies for lower income people to be able to make them better able to afford their health insurance as well, John. So the world has changed in a variety of different ways, and it's going to be really important for people to go on to Connect for Health Colorado and shop. The last piece, and then I'll let you go to whatever your next question is, John, We've also passed the Colorado option, and the Colorado option really it does a couple of really important things. It standardized benefits across the board, across health insurance companies. So if you go on to Connect for Health Colorado and you shop for the Colorado option, you know that you're going to have a really good benefit package. And it doesn't matter if you're looking at Anthem or Kaiser or Cigna or Friday Health Plans, you're going to know that you have a good health benefit package. But it also then allowed us to implement, as Kim was talking about, at the front end of the conversation, the work that the Polis administration has just done in general to lower insurance premiums. We're going to continue to be lowering insurance premiums through that Colorado option. So there's lots for people to go on to Connect for Health Colorado and shop and see what's there for them. And we're really excited to be able to help people as the end of the PHE comes to fruition.
Yeah. So Kevin, why don't we jump into it? Let's explain Connect for Health Colorado. What is it that you do, and folks?
Well, John, thanks. I appreciate the opportunity to be here with this august panel. We are the online network of place where people can come and shop for a health insurance plan where we can help them compare plans from multiple insurance companies and help them apply for financial help to lower the cost of their health insurance. Currently, we have 3 out of 4 of our customers who do receive that financial help. We also are in contact with a number of certified experts across the state who can guide the person through their enrollment process, give advice, and answer any kinds of questions. And so the way that we look at the financial help is called a premium tax credit. And you can apply that in advance that lowers your monthly premium. Now, every family is unique, and you get that financial help based on your family's specific needs, and your situation, including family size, where you live, family's estimated income. And so we work with all of the health insurance plans that come through the rate review process that Mike oversees, and lay those out so people can see them. And then we work with brokers like Meagan and assistance network sites that are locally and community-based organizations around the state. But we also have what we call certified application centers. And usually what happens is someone is engaged in the healthcare system. The doctor's office, hospital, clinic might say, hey, let's see if you qualify for health insurance. They try to make sure that they are connected if they've had some sort of loss of their minimal essential coverage. Maybe they lost their job or something changed in their life, that we can also give them an opportunity to come through if they qualify for either a special enrollment period or through the regular open enrollment period. So that's high level what we do.
Okay. So we've heard definitely from some folks who maybe they've been on your site, maybe they just kind of heard it in the news. They see health insurance premiums that cost hundreds and hundreds of dollars a month. If they go on Connect for Health, or if they end up working with a health insurance broker, that's not actually what it's going to cost them. Am I understanding that right?
Correct. On average, the premiums are a little north of $500 a month. Then on average, with the advanced premium tax credit, they're able to get that down to around $135 a month. However, what we also know is that 2 out of 3 of our customers now, because of their circumstance, are able to get to see a plan that would cost them $25 a month or less. So I think it really depends on what you're needing, what your health conditions are, how you're using, how you want to do your financial planning around it. That's why I think brokers are so important to help people figure that piece of it out. So it's kind of a question on how you engage with the system and how you want to make sure that you're protecting your family and their financial future, because we're also seeing a number of people buying up this year more so because of the great prices that folks are able to see through reinsurance and the Inflation Reduction Act.
Yeah. And you mentioned the $20 a month premiums. Maybe that only gets me in the door. That doesn't actually pay my bills. I now have to pay deductibles and cost sharing, but there is some help for folks depending on your income level, right? That's what Mike was talking.
Right. And so we have both cost share reductions at the federal and state level to really help pay for a lot of those out-of-pocket costs. And so, I will never forget, one of the first interactions I had with a customer in this job. They said, Kevin, I saved $5 a month on my premium. I didn't understand that I was going to get a $50,000 bill when my husband went to the actual emergency room. And so those are things that people really need to think about, that, penny wise, pound foolish, just in case of that. You got to be really thoughtful about your health and your conditions. And I think that's why we try to provide so much assistance, because it's a very big decision, not just from a financial standpoint, but it's your health. Very few things are going to be more important for you to think about.
Yeah. And Meagan, let's turn to you now. So Kevin just mentioned there's a lot of different options to sort through. What do you as a broker, how do you help people find what plan is right for them? What should they be looking for? What things should they be? And when is it right to go to a broker to help out on these things?
Thanks, John. So that's a big question, but the key components, excuse me, the key components that we have folks look at, of course, they're going to be looking at the premium, right? Because that's one of the first things they see. So they are shopping on price, whether they look at the other benefits or not. That's one of the first things that they're looking at. Beyond that, I also talk with my clients about looking at, to Kevin's point, what type of copays you're going to be paying for the benefits that you're going to use most often. So things like urgent care, primary care visits, if you have a specific condition and maybe you need dialysis or something like that, looking at those day-to-day costs, but then also looking at the out-of-pocket maximum for the plan overall. The deductible is important because that's first dollar expense to the insured, but the out-of-pocket max is what's key because that is their ultimate financial exposure beyond their premium for the year. So looking at not just the cost of the plan itself, the premium, but the value that it's providing. So benefits versus value, and really assessing, if I know I have a surgery coming up, or I know I have planned physical therapy, or things like that, looking at that out-of-pocket maximum to assess what their true financial exposure will be beyond just the premium.
Right.
And
Well,
to answer your second part, oh, sorry. To answer your second part, when to go to a broker, always. There is never a time that I can think of that a broker could not help someone, right? And I always tell folks, in fact, I think I've said this to you before, John, the premium stays the same regardless of if you use a broker or not. So doesn't have to be me, right? I know I'm not everybody's cup of tea, but for heaven's sakes, find a broker. They will help you analyze the market, understand what a carrier's customer service looks like, what you can expect from that carrier, what their network looks like, what their pharmacy benefit looks like as far as formulary. Are your drugs going to be covered? Is your doctor in network? All of those key things that people need to know before they ultimately select a plan.
Yeah. And in case people didn't pick up on that, another way of saying what Meagan just said is that brokers generally work at no cost to the clients they serve. Yeah,
that's right.
John, can I just jump in there just for one sec? Because I do think that a lot of what we end up talking about, right? Everybody that's on in this conversation right now, we're all health policy wonks to one degree or another, and a lot of what we end up talking about, I know, can be overwhelming. But I think the point that Meagan just touched on, that Kevin touched on, that Kim touched on as well, that kind of runs through everything that we're talking about, is that there's resources out there to help you figure this out. And that's so vitally important. You're not on your own. And I know that this is going to be, in many ways, an overwhelming time for people as the end of the PHE comes about. But really, please take advantage of those resources, whether it's brokers, whether it's the assisters, whether it's everything that Kim's shop is putting out for information, everything that my shop is putting out on the information front. We're here to help, and we really do want to help.
So I think we want to dive into reader and viewer questions right now. So again, if you have a question and you want to use the YouTube chat function, or you can send it to questions@coloradosun.com. Kim, we're going to go with, because we have a lot of questions on how the redeterminations are going to work. So first of all, can you explain eligibility thresholds, income levels? How do folks know, or how can they sort of expect if they're going to be able to requalify, or if they're going to need to be looking for other coverage options?
Yeah, thank you, John. So, Medicaid, or Health First Colorado, is income based for the large part. For 96% of the people, it's income based. So the points of where you would be able to receive coverage, and I'll give for a single person or for a family of 4, It's about $19,300 for a single person, and about $39,000 for a family of four. And when you look at the Child Health Plan Plus program, it's about double that. And through that, the parents aren't covered, but the kiddos are. So you double that for a single person, it's about $38,000, and for a family of four, it's about $78,000. So those are about the attachment points, if you will, or the eligibility criteria points.
And CHIP can also cover people who are
Pregnant women. Yeah, pregnant women.
Okay. So we had questions on if there could be a possibility of people who actually do qualify for Medicaid could end up, because they don't get the paperwork right, or for whatever reason, they could end up being disenrolled. Can they get re-enrolled, and how fast could that process happen?
Sure. So the first thing we want to do is prevent that from happening, right? So we are doing everything we can to get us your addresses, and we have so much information. Providers put up these posters, all of our partners put up these posters. So we want to first prevent that from happening. But let's just say somebody doesn't answer the mail, and they, just don't see it, and don't see we've got 4 additional phone calls going out to people, or text messages and emails trying to make sure that that circumstance doesn't happen. But if it does, they need to go back and get that application turned in and completed. The counties, once they receive a completed application, have about 15 days that we target to turn that around. So we try to have people re-enrolled in about 30 days. So that's the goal, but let's all set a shared goal of keeping Coloradans covered so we don't have those sorts of gaps.
And so, sorry, you said 30 days you're expecting to be the on people's
when
eligibility?
Somebody fills out that application, we ask the counties to, once they have a completed application, to do that in 15 days. So if somebody realizes, oh, no, I should have done that last week, and they get it back in, they get that completed application, we're trying to get that done in 15 days. So that would be about 30 days for them to realize it, figure it out, get it in, counties receive it, and 15 days after that. Sometimes they're missing some piece of information, but they shouldn't. If they're careful going through that application, it takes you step by step.
Okay. And you mentioned some of the communication efforts, but can you just explain what can expect to hear from you?
So, well, soon we'll start some public service announcements, I'd say over the summer and maybe a little bit before that. But the bottom line is we've asked all of our partners. So that means, we have 100,000 healthcare providers that are enrolled in Medicaid, and we've asked all of our hospitals and our physician contractors and all of our regional accountable entities. We have case management agencies that work with our individuals with disabilities. We have people that oversee homeless shelters. We are trying to get flyers up everywhere. That's in addition to all of the newsletters that we're sending out, the calls as people are in their renewal cycle. The regional accountable entities and our department are trying to hit that person 4 times to make sure they don't miss. And then again, bright red lettering on an envelope coming to your door soon at your renewal, 60 days before your renewal. So lots of communications going on, John. Again, the goal, keep people covered, keep Colorado covered.
And we did hear from some folks who were concerned about communications to communities that maybe English is language or the language they speak, the deaf community perhaps. How are you sort of addressing some of these equity issues?
So that's, equity is sort of our middle name. That's what we do. It's the DNA of HICPUF. So we do everything in English and Spanish, and people have preferences that they enroll with. So again, of the 35,000 texts that we sent out just in the month of March for May renewals, 28,000 were in English and 7,000 were in Spanish. Of the emails that we sent out, it's probably about a 10%, 90% Spanish, English. And then for those that are deaf, we use texts and emails so that we have a variety of different ways. And then individuals can come on through Peak as well in the deaf community to get information there as well. So we try to meet people where they are and communicate with them the way that they communicate their preferences to us.
Yeah, and so Peak is the online portal for people to use for Health First Colorado, which is another way of saying Medicaid in Colorado?
Yes, it's the eligibility application. We also have an application just for healthcare in general, that, benefit questions, not deductibles, we don't have deductible questions, but claim questions, benefit questions, etc. Provider network questions.
So we had a question who has a redetermination date in 2024, and they're wondering, just to be clear, that they from you until at least a couple of months before then,
Exactly.
maybe next year.
Exactly.
Yeah.
But if they want to be proactive, just get on to Peak and update that contact information, please.
Is there a month in the coming year that you're expecting to be more active for notices?
Not really. I can tell you every single month, but in general, I wouldn't worry too much about that to be some, 50% of the volumes in 1 month. It's usually between, say, 65,000 and 100,000 people.
Okay. You're thinking this is a pretty level, smooth kind of process. You're not going to see a huge surge.
No, not that we should worry about as a system.
Gotcha. Okay. Let's move on to questions about how you find coverage and how you maintain continuity of care, which is a big important. So Mike, for you, and obviously our other panelists, please jump in. We had some folks who were just wondering about emergency plan, catastrophic sort of stopgap insurance. Is there any option like that out there for folks?
There's not any kind of stopgap insurance out there for folks. Well, I mean, depending on exactly what the person was thinking about when they asked the question, of course. But I think what's most important is that special enrollment period that we talked about at the beginning, John. That really is going to allow people to get enrolled very, very quickly. And if they're planning along the lines of what Kim was talking about, they'll be able to plan for their enrollment date to coincide with the date when they would potentially roll off of Medicaid. As far as continuity of care type questions, and for folks out there, I promised you that it was going to try and not be too wonky. But what John's talking about with continuity of care really is that if you're in the midst of getting treatment of some kind, that you're going to be able to continue to get that treatment with the doctor that you have in place or at the facility that you're getting the treatment. We do have laws on the books, John, for continuity of care in certain specific situations. It is pretty fact dependent, so I don't want to tell people that there's going to be a continuity of care in every single situation. But what Kevin's shop has done a very good job of, and what Meagan and other brokers can help folks work through, is if they have specific doctors that they want to be able to continue to see, they can work with brokers or work with the tools that Kevin has through Connect for Health Colorado to see if the doctors in whatever health insurance company that they're shopping for are in the network for that health insurance company. And those tools, those resources really are what we talked about before too, John. Those are the tools and resources that I think it's going to be really important for people to utilize and make sure that they are getting the care and the coverage that they need.
Meagan, I was hoping you could talk more about that. How do you make sure that people are able to keep the doctors that they're seeing or the currently on? How do you work with clients and sort of look through the health insurance plans to make sure that folks can maintain that and keep that, which, as Mike mentioned, continuity of care is so important.
Yeah, absolutely. It's very important, and that's a big part of what we do is the research to ensure that folks are able to keep those doctors that are important to them and make sure those prescriptions are covered. So all of the carriers provide online search tools that they commit to the broker community and the consumers that they serve, that they update frequently. So when those contracts change or things like that with the different provider offices and whatnot, they keep those online search tools updated. So we typically will provide what's called a disruption report and let a client know, if you see Dr. Smith, they're in network with Anthem, they're not in network with Friday, they are in network with Kaiser, et cetera, so that they can see that, especially if they have multiple providers and we can't find all providers in the network. We'll, talk with them about that. We have 4 out of your 5 doctors are in network with X carrier. So we need to decide is there, a doctor who's a deal breaker here? And that needs to be our primary focus. Or sometimes we get lucky and all of the providers are in one network and that becomes the clear choice. And so then it's a matter of narrowing down the plans that are available within that carrier. We do the same thing for formulary research. Formulary is the proprietary list of drugs that a carrier covers and how they cover them. Do they cover them as a tier 1 generic or a tier 3 non-preferred brand? And what does that look like as far as copays are concerned for that person when they go to refill those prescriptions? So we help them with that research and then have a discussion about what the impact is for office visits and with those providers or facility fees when they're going to see those specialists and then the pharmacy refills. And one thing I will say is that one of the least accurate ways to find out if your doctor is in network is to call the doctor's office. And that is not a knock on the provider's office at all. It is simply that the person who calls will say, oh, hey, do you guys take Aetna, or do you take Kaiser, or do you take whatever, insert carrier? And the front office person will be like, yeah, we sure do. And they might have a list there, but they might have, Kaiser Select, or they may have a network that is not specifically covered, or that provider, I'm sorry, is not specifically in that network. And so they need to be very careful about calling the doctor's office to ask, make sure they have the specific network name, because that is crucial to finding that information out.
Kevin, is this something that people can see this level of detail when they shop on Connect for Health as well?
Yeah, we do have a way that you can see that, but I have a little trepidation. I agree with Meagan that you need to confirm if there's any specific thing that you're looking for. So we like for people just to double check if they're concerned about that at all. I think there's some improvement we can make in that system. I think that's the best way I can say it.
Yeah. Questions about mental health care, especially, and maintaining continuity of care. Mike or Meagan, is there anything that you want to add?
I'll start, Meagan, and then you can jump in. So, John, I think that we could probably fill a whole hour on mental health care issues just in general. I think that there's definitely going to be options that are available to people. The Colorado option, for example, has mental health care visits that are before deductible. So before people have to pay any of those cost shares that we've been talking about, people can go to the mental health care doctor and get coverage and get treatment. I think the question when it gets to the specifics about continuity of care, we're hearing a lot really over the last couple of weeks about what's referred to as pre-licensure work and pre-licensure billing. So for providers that aren't licensed, that don't have a specific license, in the Medicaid world, they do have the ability to bill to some degree and get paid for some of that work. That isn't always the case in the private insurance marketplace. It is going to be carrier specific. We don't have specific laws on the books regarding pre-licensure work. And as much as people talk about us having a lot of power at the Division of Insurance, we can't fix every problem that comes our way, even though we really want to. And we've got ideas about really trying to have to push the private insurance marketplace to be more proactive on the pre-licensure work front to deal with some of those continuity of care issues, John. But I don't want to overpromise to folks either, especially I know that there are some providers on tonight that are talking about that, and I don't want to overpromise to them that I'm going to be able to completely fix that issue. But it's something that we're paying attention to and something that we're having conversations about. But Meagan, anything you wanted to add in there?
Yeah, I think you made a fair point about the Colorado option plans. And one of the things that makes those plans unique is that the amount of stakeholder input to design those plans was outstanding. I mean, there were so many meetings regarding benefits, how they should be structured, pre-deductible, post-deductible, co-pay driven, et cetera. And one of the primary focuses was mental health and making sure that folks that need care can receive that care and be cost efficient. Beyond that, I also talk with my clients about access to their employer plan. If they have access to their employer plan, we find that those plans have a much better overall benefit package for mental health than the individual plans. And that's something that, when in my capacity as president for our state organization, I do sit on a few broker roundtables with the carriers, and we have that discussion that one of the things that is lacking on the private market, individual and family-based health plans is mental health coverage. And so looking to improve that. And so the Colorado option is a very good solution for that because of the focus that was paid to that critical benefit.
Well, so Kim, let me ask you this. What is the role for employers here, and what can employers be doing to help out? And they may have folks who are currently covered by Medicaid, but they have the potential of offering them employer-based insurance.
So I'll start, and then I'll invite Mr. Conway to join in. But, employers get their coverage from the big carriers. Sometimes they use a little TPA and a network, but for the most part, they get their coverage from carriers. And so we need the carriers and the brokers to make sure that employers are educated, because the hundreds of thousands of employers in the state have not kept up with this big issue that's going on, this huge movement, transition of care, of people moving, or transfer of coverage of people moving from public coverage, Medicaid or Health First Colorado, to private. And so we really need the brokers and carriers to do a good job of asking the employers to literally notify all of their workers that aren't enrolled, all of their employees that aren't enrolled, and tell them, look, if you're covered by Health First Colorado, you've got a certain window to enroll if you are no longer eligible. And again, when you have a full-time job and you're making more than that, $19,300 or so, and that, $39,000 for a family of four, and you lose your coverage because of income criteria, that you have a certain window to enroll. And so we really need the employers and their partnership to be reaching out to their employees and to educate them so that they know you have this window, and that's an HR function. But the brokers are getting schooled, and they're instrumental in helping make sure the employers know how they can be part of the solution to make sure that their employees don't go uncovered. And for an employer, you really don't want to let that happen, because once that employee does enroll, they've had built up, pent up demand, and they're likely less healthy because they probably didn't get the care they should have because they couldn't afford to. And that's why the shared goal, keep Coloradans covered, keep cocovered.com. And then Mike, I'll invite you and Meagan, of course, to add.
So first, apologies. There's a 5-year-old downstairs that I think is fighting monsters, and he's being very loud right at the moment. I'm trying to get him to be a little bit quieter. But if you hear that, I apologize. I think everything that Kim just said was absolutely spot on. So I think that there's there's just a practical reality that I've been talking about quite a bit with our team, and when I've been out talking about the end of the PHE and at events like this, that I think we have to be cognizant of, and that's that it's going to be super confusing time for people, right? It's going to be super confusing in all sorts of different ways, right? So the more that employers can do to lean in to help people deal with that confusion and understand that there are options that are going to be available to them, if they do have options available through employer-sponsored coverage, I can't emphasize how important that is going to be. And the broker community is obviously going to be a part of that too, right? So most employers have consultants of some kind that help them purchase their health insurance coverage. We need those consultants to be going, to Kim's point, to those employers and reminding them that this is coming and that they need to be having these conversations with their employees. Because the other piece that Kim talked about is also spot on about it's not that people will get sicker if they don't get coverage, and then it will end up costing employers more on the back end. But even, John, not to be dire about it, people may die if they don't have this coverage, right? Kim's right. If they can't afford coverage, people don't get the healthcare that they need, right? It's been proven time after time after time. So it's not just that it's necessarily going to cost employers more, which they're obviously very rightfully concerned about long term. It's also going to put people's lives at risk. So everything that we can do to keep people covered is key.
Yeah, absolutely. Oh, sorry.
No, please go
We're
ahead.
talking. Okay, we're talking with our employer groups, my specific clients, and then the broker community at large about posting flyers in common places in the workplace, as well as the HR team, or even if they're a small employer and the HR team is the owner, or whoever wears 10 hats within their company, but making sure that they look at the folks within their company who have waived benefits, because that person doesn't always have to disclose why they're waiving benefits. They may be on their spouse's plan, but they may be on Medicaid, and that's why they've waived. So that said, we're encouraging them to reach out to those folks who have waived and let them know about what their special enrollment opportunities look like, what that timeline is, so that they know if they receive notice that they have X amount of days to get enrolled on their employer plan, and to be able to provide rate information. If you are a family of 4, this is what it will look like with your employer's contribution, and then what your deductions will look like per paycheck, as well as different enrollment options, because they may be in an income situation where their children are eligible for CHP plus, but the spouse and employee themselves are no longer eligible for Medicaid benefits and need to find an alternate solution. Then beyond that, we are also working with, at the national level, SHRM, the Society for Health Resource Managers, to let them know, because sometimes a company will not use a broker. They may have someone in-house who's a benefits specialist. They may not be a licensed broker. They just have enough knowledge of the industry to secure those benefit plans and packages for their company. And so we're also talking with them to make sure that those folks are aware as well.
Mm-hmm. And
John,
there's another option here that we haven't. Sorry, go ahead, Mike.
Can I just talk about one thing that I think is really important? Again, for folks that were potentially enrolled through Connect, or that maybe shopped on Connect for Health Colorado, that were in a situation like Meagan talked about before, where maybe they had employer coverage for one family member that had some level of subsidy for that one family member, but didn't maybe have any assistance for the rest of the family. They used to be frozen out of being able to get any of the tax credit help that Kevin talked about at the front end when they went to Connect for Health Colorado. That's not the case at this point any longer. So it's going to be really important for people again to go and shop and see what's available to them, because the world really has changed. So it's shopping, as we always talk about, is really going to be key.
Yeah. And Kevin, we do have some people who they just want to know bottom line, what this is going to cost me. You've kind of gone over that a little bit, but can you talk a little bit more about what people on average are paying on Connect for Health?
Yeah, on average, it's around $135 with the premium after you have the tax credit. After that, we have a tool that helps you kind of estimate if you're a high, medium, or low user of the healthcare system, so people can kind of look and see if I think I'm going to go to the doctor more than just for well visits, and I don't plan on going for the emergency room, but not saying everybody plans for that. What your choices really look like, because I think it's really important for folks to understand their engagement with the system and how that might impact what they're going, because that will drive a lot of that cost. And so, we'll see some folks that say, I've got a chronic condition, I've got this list of meds, I've got a specialist. They're going to look at different plans per se than somebody that's young, invincible, that feels like, oh, nothing's going to happen, but in case something happens while I'm skiing or snowboarding, I just want to make sure I've got some sort of coverage. And so, though it's hard to say what the average is, but what we've tried to do is look at different personas. So like a 25-year-old in Denver, what their options might look like would be different than the 50-year-old female in Washington County. But we try to put it on our website so people can kind of see themselves in that situation and say, oh, that kind of looks like me. So we're trying to make it a little more relevant to what they are versus saying, here's the number you should be looking at, because I think that might not be the right guidance.
John, I want to jump in here for a sec. So what Kevin is alluding to is the Quick Cost Plan Finder. And I will say that tool is the #1 resource that I use on the C4 website, because so many people think, oh, I won't qualify for anything because I make X amount of dollars per year. And I think I've counted, I think it's like 7 clicks, depends on how many family members you have. But in 7 clicks, you can figure out, do you qualify for anything at all? Is it even worth going through this process or not? And I can't tell you the number of times I've had someone who is genuinely shocked that they qualify for anything because they think, oh, I'm middle income. Like I'm okay. I don't need assistance. And it's like, wait a minute, just check and see if you qualify for something. And that tool is a great resource for folks to just go in and see what they might qualify for. And then from that one page, you can click through to the, how often do you use this for pharmacy or, primary care, et cetera. But ultimately, then you can look at some of the plans and it'll show this is what the plan was with your tax credit, and then here's what you will pay. And I think that also puts it into perspective for folks because they're like, oh, wow, my premium just dropped from, $400, the true premium, to $135. And they're able to see that. And I think that really makes the connection for a lot of folks.
Yeah. Mike, one question for you. We have some folks who are whether this influx of people into the commercial market, whether it'll end up impacting premiums in the commercial market one way or the other. Do you have insight on that?
Yeah, I think it's a fair question, John, for sure. It's a good question. So it's not my expectation that it will impact premiums in any meaningful way, for a variety of different reasons. One, right, when we're talking about the number of people that we really expect to roll off of the end of the PHE into the private insurance, into the individual market in particular, it's not a massive number of people. But I think probably far more important than that, John, it's actually what Kim touched on before and what Meagan has touched on a little bit too. It's that what's most important is that we get people the healthcare coverage that they need when they need it. Because what we know is that if folks aren't able to get the healthcare that they need, then long term it's going to cost the system far more, right? Because they're going to enroll, when they absolutely do need that coverage, they're going to come in and they're going to enroll at that point, and then their conditions will be worse, which will be more expensive to treat, so on and so forth, John. So what's vastly more important to me than worrying about any maybe kind of marginal premium impact right now today is that we get people the care that they need, because we want to take care of people. And longer term, it'll just cost more if we don't do that.
And there's one more question I want to get to on this area before we move on, and that's an option yet for families potentially. A lot of times young people are on Medicaid. They may now no longer be eligible, but they could be eligible to go on their parents' plan. So Meagan, when is that an option? And when, as a parent, do you know that that's the right choice for your?
Yeah, that's a great question. So because of the Affordable Care Act, a dependent child can stay on their parents' plan through age 26. So the month that they turn 26, they will phase off of that plan. Most commercial plans, it goes through the end of the month. So no one's having to prorate coverage if their birthday's on the 7th or the 21st or whatever. It just goes through the end of their birth month when they turn 26. Beyond that, what I advise most of my clients is look at individual child. Let me backtrack just a second. I should clarify that the child being on their parents' plan is income and financial independent. So if they're out on their own, they have their own job, they're, doing life, they don't live with their parents, they're gainfully employed, all of those things, doesn't matter. Even if they're married. Now their spouse can't join their parents' plan. Their children cannot join their parents' plan. Let's say they have young ones. That doesn't happen, but the dependent themselves can join mom or dad's plan, okay, through age 26. So beyond that, what I advise clients is if you look at premiums for your 20-something adult child and they don't qualify for a tax credit, or they, the benefits that are being offered through their employer are not a right fit for them, say it has a crazy high deductible or something like that, then let's look at what the cost would be for them to join your plan. What do your benefits look like? And then compare that value versus premium. And so it comes down to that cost impact. The other thing too is if you're helping your child pay their deductible or pay their copays, pay their out-of-pocket maximums, why not have them join your family plan? Because then you're contributing to one family deductible, one family out-of-pocket maximum, rather than having those split apart. And then the financial exposure, of course, is increase significantly in some cases. So, pool that all together and have the family together on that deductible and out-of-pocket max.
Yeah. And Meagan, if I can ask one more question here, we wondering about things that are sort of insurance-like, but they're not quite insurance products. So this would be with a doctor's office where they say, hey, pay us sort of a subscription fee essentially, and we'll provide X amount of healthcare for you. This could be like a sharing ministry. How do you advise people on those situations?
Well, I will say that I don't typically advise my clients the way that most, or some, I shouldn't say most, the way that some brokers do. And part of that is because I was raised by an attorney. So I believe that if I pay you something, you should be contractually bound to provide me with something in return, right? So what is a little bit alarming about some of the sharing ministry plans, and I've read quite a few of their contracts, is that it clearly says just because we've covered something for you in the past doesn't mean we have to cover it every time. And it's on a situation specific review. So I caution people on joining or paying for something that they can tell you, we might not cover this just because we covered it before. Also, those sharing ministries are faith-based. And so they do require some form of testament of belief in a higher power. Some are much more specific than others. Some require a letter from your pastor or member of clergy that say, yes, they are actively engaged in our church. And some folks aren't comfortable with that. I also think that the sharing ministries pull on people's heartstrings, right? And so they're using faith to say, oh yeah, we've got you covered. Well, okay, but this is transactional and we're talking about my healthcare. Do they really have me covered? So that's the sharing ministry part of that. And are they the right fit for some people? Certainly. Absolutely, they can be the right fit for some folks. But that needs to be a very, very specific and conscientious decision to do that. As far as the other concierge medicine or direct primary care, you pay the doctor's office X amount in membership per month or an annual fee. Those can be a good fit, but I still advise people to have a catastrophic plan in partnership with those because, that doctor's office isn't going to cover you if you have to go to the emergency room and have emergency surgery, or, you're out skiing and break your bone and they have to send up ski rescue to come get you and bring you down. And then you're paying some orthopedic surgeon who, let's be real, they live in Vail and there's a cost of living difference up there, So I do caution folks, those can be a really good fit, right? To be able to use direct primary care and have lab and pharmacy and some of that stuff at your fingertips for what's pretty much a minimal fee for most of them per month. But I still advise folks to have some sort of catastrophic coverage. For the whole point of insurance is for the what ifs, right? Why would you do something that doesn't cover you for those major expenses like a surgery or emergency care?
John, I'd be remiss if I didn't jump in there on the sharing ministry piece.
Yeah, of course.
Because we get complaints about sharing ministries. We get complaints about insurance companies too, just to be fair here. But I think everything that Meagan just said about sharing ministries is exactly right. Folks really need to understand what it is that they're signing up for, and more importantly, from my point of view, what it is that they're not signing up for. Right. So people have come to expect that when they're signing up for a health insurance plan, what they think is a health insurance plan, it has certain benefits and it has certain coverages that are just guaranteed, because that's what we've really tried to kind of instill into people on the way that they're thinking. But the sharing ministry plans don't have the same benefits as the Affordable Care Act. They don't have the requirements in place to make sure that the benefits are actually paid just along the lines that Meagan just talked about. There's all sorts of exceptions that the sharing ministries build in so that they don't pay for coverage in a variety of different circumstances, whether it's because you don't have the same faith that the sharing ministry may require you to have, or you just violated some morality clause within the sharing ministry, for example. Those things truly do happen, and people end up being stuck with massive bills because they didn't understand that what they were signing up for wasn't a health insurance plan, and they were signing up for something that had no guarantees. And very specifically in the policy, they're not policies because they're not contracts, as Meagan very well laid out there. But in the documents for the sharing ministry plan, they say very upfront that they're not going to necessarily cover anything, right? So it just becomes very, very important for people to, again, understand what it is that they're not signing up for, because they're truly not signing up for coverage like they think they are quite often in my experience.
So Kim, I wanted to move to some questions that we got from healthcare providers. These would be doctors' offices, clinics, places that serve Medicaid patients currently. And they are wondering, one, how they can support their patients, but two, they end up knowing if their patients are no longer covered, and then they may not be able to get reimbursed for the care they provide.
So first, thank you, providers, for taking care of our Health First Colorado members. We appreciate you. So we have communicated to our providers flyers that they should be putting up to remind their patients to take action, to look for, to know the renewals coming, to update their contact information. And we actually have flyers that they can put up, and there's a little QR code that people can put their phone right up against and get the information. So one, we really want the providers to do that. That will help keep their patients covered so they don't miss that renewal and stop that gap in coverage that we're all trying to avoid. So from a support perspective, we're asking them to do that. We're also asking them when the patient is actually in their office and at the visit for the to remind them to look for their renewal. Next, our providers check eligibility. Their portals to check eligibility are accurate. So they should be checking those portals. And if somebody's making an appointment, they're checking eligibility and they're not eligible, they're an opportunity to communicate to that member that you're showing up as not eligible. So the member goes, uh-oh, I need to take an action. If the provider is providing care to somebody that's not covered, we don't cover that for people who aren't eligible for Medicaid and enrolled in Medicaid. We don't cover those claims. So best goal for all of us is work together to keep Coloradans covered. And I just want to say that all those providers can get tools that they can play in their waiting room. So we have videos that play in English and Spanish and with captions that say, here's how to update your contact information, Health First Colorado members. Here's how to handle, here's the steps for a renewal. Here's how to get connected with other coverage. So we certainly want those providers to use all of those tools. There's an entire toolkit for providers to come in and help. But again, all of that is at keepcocovered.com that people can go in and you can get various toolkits for renewals, et cetera. And then they can remind their members to go on to the site is healthfirstcolorado.com/renewals. So all of that is helpful. So again, best that we don't have people that have a gap in coverage. And for those members who think they've been inaccurately determined ineligible, they can, before the end of that renewal month, appeal that decision. And during that appeal, those members are covered. So the providers, those individuals will still show up as eligible in the eligibility portal that the providers have access to.
Okay, great. Well, hey, I through our questions. Did anybody have something that they thought we missed, or that closing comments, anything else you want to say? We'll start with you, Kim.
Members, please look for your renewal packets. Members, please update your contact information with us again at Peak or with your county, but use Peak because it's automated and the counties are obviously busy processing renewals, et cetera. Providers, please post those posters up. Remind your members how important it is to look for those eligibility packets and to update their contact information with us. All Medicaid partners, please put up those posters. And every time you engage with a member, be part of the solution. Help the members remind them that they've got to renew this. You've got to fill out the paperwork. The 3-year pause is over, and we've got to work together to keep Coloradans covered. Everybody, please do your part. Thank you. And thank you, John, for doing this session. We really appreciate you and the relationship that we share with the Sun and how well the Sun is such a good organization to spread the good word in events like this. Thank you.
Oh, thanks, Kim. Mike?
I'm not going to say thank you to you, John. No, I'm just joking. Thank you for Kim's right. You are really good partners. You've done events like this on other issues that are honestly, I think, truly helpful for people, to help people understand issues. And I think everything that Kim just said obviously is spot on, as always the case when Kim is talking about issues. But I think the piece that I would take it just for the next step, right, for people that are rolling off of the end of the PHE, it's going to be overwhelming, folks, right? It's going to feel overwhelming at first, but there are tools, and everything that we talked about today are out there to help, right? And there's people that want to help. There's great brokers like Meagan that are incredibly thoughtful and intentional about the work that they do, that want to help you. There's the assisters that Kevin has through his shop that are there, that want to help you. There's the tools that Kevin has on Connect for Health Colorado that want to help you figure out what your availability, what your coverage availabilities are. There's your employers that in the HR shops that are going to be there to help. So I know it's going to be overwhelming at times, and I think the most important piece, the most important message that I can get out to folks is that there are people there that want to help. So reach out to those folks that want to help, because that's what they're there for. And certainly our shop at the DOI, we're here to help too. So if you want to give us a call at 303-894-7499, we can help you there. You can go on to doi.colorado.gov. We have resources and information there for folks. But I think that's my core message, John, is that there are people out there that want to help, because it's going to be a confusing time. Take advantage of that. That's what we're here for.
Thanks. Kevin.
So thanks again, John. This is always a really good time to have to be able to share with you. I have to thank the rest of my panelists. I get to work with them all the time. And I think, this level of coordination, collaboration is really unprecedented. And so Kim's been great leading the charge for everybody. Mike's talked, I think, a lot about what we're trying to do to make sure we keep people covered. We want to make sure we're just letting people guide. We're agnostic. We just want you to get covered. So if you want to start with us, we'll get you to the right place. And very often that place is Meagan or someone in the broker world. Just reminding folks, we do have assisters out there as well. If you you don't even know where to start and you're like, which direction do I go? They're in the community. We've worked very closely with the regional accountability entities that are looking at those Medicaid patients to make sure we have a nice warm handoff, a white glove approach. We've looked at that, and we've been trying to connect with the issuers just to make sure that folks that are on Medicaid in a Medicaid plan, we also move them to a marketplace plan. So we're just trying to make sure that anywhere we think there might be a gap, we're trying to build a bridge and make sure that gap's not, that doesn't fall in, people don't fall into it. So again, really appreciate the opportunity to be with everybody. We're here to help, and that's really what we're about here. So
thank you, Kevin. And Meagan?
Yeah, thank you. And to echo everyone's comments, thank you, John and the Sun. You guys do a really good job of getting information out to folks, and it's very important. And also thanks to Anthem. I think it's important that you have sponsors so that you don't bear the burden of costs sometimes. So beyond that, I would say that the tools that are available out there, Connect for Health has a search tool to find a broker. Put in your zip code and it will help you find a broker that's local. Talk to your friends, talk to your family, find out who they're working with, because then you can trust that individual. Beyond that, our organization, we recently went through a name change at the federal level. So we are the National Association of Benefits and Insurance Professionals, so NABIP. If you go to nabip.org, they also have a find an agent function that you say that you have family in Texas or you have family in Oklahoma or whatnot, and you've listened to this presentation, you're like, gosh, I wonder what, my aunt or uncle is doing, or my cousin, whatever. They can help you search for someone at the at the national level by state, by zip code as well. So use the C4 tools that are out there to help you search, and establish a relationship with a broker now. If you think there's a chance that you may be rolling off of Medicaid at some point in the next 14, 15 months, reach out to someone. They can start helping you now, especially if you get those renewal documents and you have questions about how to fill it out, or, where do I find this information? A broker can help you with that as well. Even if that means that they don't end up doing business with you, they send you Medicaid, that's okay. Right? That means that they're providing a service that's important. And some of the assisters can do that as well. Kevin's talked about them. You can work with both an assister and a broker. And so the assisters are there to help you with terminology and, where to start. What the heck does all of this mean? And then a broker can come in and help you with market analysis and formulary information and all of that kind of thing. Take it one step further. So just use all the tools that are available to you.
All right. Well, thank you, Megan. And thank you to all of our panelists for being here. I know we kept you a little bit over time, but I think this is all super important information to get out to folks. So I will say to people, there were some very technical questions that we didn't get to, mostly because we didn't have the information right on the spot to be able to answer them. If you want to email those to us at questions@coloradosun.com, we'll harass all these people online and make sure we get answers to them, and I can email them back to you. So I want to thank you to everybody who answered the questions. Also want to again say thank you to Anthem for sponsoring this event. That's Anthem Blue Cross Blue Shield of Colorado. You can find them at .com. And if you are interested in rewatching this event, sharing it with others, it'll be available on the Colorado Sun's YouTube page. And lastly, I can't let us go without noting that the Colorado Sun, news organization, member supported. If you like what we do, if you want to help us out, you can go to coloradosun.com/join to become a member. Otherwise, we just always appreciate your readership. We always appreciate you being here and being a part of these panels and really being part of this community engagement and interaction. So thank you again to our panelists, and hope